Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Before we jump into today's topic, I want to highlight an important illness that carries a heavy symptom burden and significantly affects quality of life for both adults and children. Atopic dermatitis, also often called eczema. Atopic dermatitis is a common, chronic, relapsing inflammatory skin disease marked by itchiness, redness, and sometimes oozing, crusting, and scaling of the skin. It is one of the most common skin conditions in children, and about 6 out of 10 children with atopic dermatitis develop symptoms before their first birthday. In young children, atopic dermatitis can look very different depending on age. For example, in infants 3 to 6 months old, atopic dermatitis most often appears on the face, chin, and scalp. The diaper area is usually spared, and the skin may look red or discolored with weepy-looking sores. In babies 6 to 12 months old, you may still see atopic dermatitis on the face and neck, but it commonly shows up on elbows and knees, the area that are easily contacted and rubbed as babies start crawling. In toddlers around 2 to 5 years of age, atopic dermatitis tends to favor the creases of the elbows and knees, as well as the wrists and hands. Although you may also see some lesions around the mouth or on the eyelids. Understanding how eczema presents at different ages is important because early recognition allows for earlier treatment and may help prevent worsening of the disease, especially now that we have more treatment options available. And today we're introducing Eucrisa, a steroid-free topical medication for atopic dermatitis that works through the PDE4 pathway and is approved for patients as young as 3 months. In a previous episode, I covered steroid-free, another PDE4 targeting topical therapy approved for atopic dermatitis starting at 2 years of age. If you have not seen that video yet, the link is above. But in this episode, our focus is Eucrisa Ointment, the only steroid-free topical treatment FDA approved for mild to moderate atopic dermatitis across infancy, childhood, and adulthood. So, let's break down the 5 key things every patient, parent, and caregiver should know about Eucrisa. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Eucrisa and who is for? Eucrisa, with its active ingredient, Crisaborole, is a prescription topical medication approved by the FDA for the treatment of mild to moderate atopic dermatitis in adults and in children 3 months of age and older. It was initially approved for patients 2 years and older in December 2016 and later expanded in March 2020 to include infants starting at 3 months, making it one of the few prescription eczema treatments available for very young babies. Eucrisa is a 2% ointment applied directly to affected skin. Its steroid-free profile provides an appealing choice for patients and families who need a long-term option without the typical concerns associated with topical steroids, such as skin thinning, stretch marks, or steroid-induced folliculitis. Eucrisa can be used on sensitive areas, including the face, eyelids, and skin folds, which adds safety and convenience in everyday use across different age groups. Second, how does Eucrisa work? Eucrisa targets the phosphodiesterase 4, or PDE4 pathway, which plays a role in regulating inflammation within skin and immune cells. PDE4 breaks down an important signaling molecule inside cells called cyclic adenosine monophosphate, or CAMP. When PDE4 activity is high, CAMP levels drop and inflammatory signals increase. By blocking PDE4, Eucrisa helps raise CAMP levels, which in turn reduces the release of many pro-inflammatory mediators across multiple immune pathways. In atopic dermatitis, this translates into less redness, less itching, and less irritation in the skin. The result is a broad balanced reduction of inflammation. Eucrisa is formulated as a petrolatum-based ointment. So in addition to its anti-inflammatory effect, the ointment itself acts as an emollient. It helps lock in moisture, reduce water loss, and soften dry, irritated skin. Put simply, Eucrisa helps quiet inflammation, while the ointment base supports the skin barrier over time. Third, let's talk about dosing and application. The usual dosing for Eucrisa ointment is twice a day, applying a thin layer to the affected areas of skin. It can be used on most body sites, including the face, eyelids, and body folds. Once a good clinical response is achieved, your doctor may consider reducing the application frequency to once daily. Eucrisa is for use on the skin only. It should not be applied to the eyes, mouth, or other mucous membranes. After applying Eucrisa, patients or caregivers should wash their hands, unless the hands are the area being treated. If someone else is applying Eucrisa for you or your child, they should also wash their hands right after application. Fourth, let's review side effects and safety of Eucrisa. In clinical trials involving patients 2 years and older, the most commonly reported side effect was application site pain, typically described as a burning or stinging sensation. For most patients, this discomfort resolved quickly within 1 day. In a longer-term safety study lasting up to about a year, no new safety signals were identified, and drug discontinuations due to side effects were uncommon. However, hypersensitivity reactions, including contact hives, have been reported in patients treated with Eucrisa. Allergic reactions should be suspected if you experience severe itching, swelling, or redness at the application site or at a distant area of skin. Stop using Eucrisa and seek immediate medical attention if you develop symptoms of a serious allergic reaction, such as trouble breathing, throat or chest tightness, feeling faint, hives, itching, redness, or swelling of the face, eyelids, lips, mouth, tongue, or throat. After approval, there have also been reports of allergic contact dermatitis in patients using Eucrisa. Because these voluntary reports come from a population of uncertain size, it is difficult to know exactly how often they occur or to prove the case is caused by the medication. In real-world practice, the key message is that patients should contact their healthcare provider if they notice new or worsening skin changes after starting Eucrisa, so they can be evaluated and managed appropriately. And finally, let's focus on safety in the youngest population. Eucrisa has been specifically studied in children from 3 months to less than 2 years of age in an open-label trial. In that study, the most frequently reported treatment-related side effects were application site pain, application site discomfort, or redness, occurring in a small percentage of patients. This pattern of local reactions in infants was similar to what has been seen in older children and adults. Other common childhood events, such as fever, upper respiratory infections, diarrhea, eczema flares, diaper rash, and cough, were also reported during the study period, which is expected in this age group regardless of treatment. Because the infant study did not include a placebo comparison arm, it is hard to determine exactly how many of these events were truly related to Eucrisa versus background illnesses. However, only 3% of patients discontinued Eucrisa because of adverse events, and most children remained in the study. One patient in the trial experienced a serious adverse event of fibrosis seizure, which was assessed by investigators as unrelated to Eucrisa. Putting everything together, Eucrisa has shown a generally well-tolerated and reassuring safety profile across adults, children, and infants when used as directed. Because it is applied topically, systemic absorption is limited, and no new safety concerns have emerged in the pediatric or infant data. And there you have it, 5 essential facts about Eucrisa, a modern steroid-free and skin-friendly topical therapy for atopic dermatitis, including sensitive areas. It's approved across a broad age range starting at 3 months, is typically applied twice daily with the potential to step down, and offers effective inflammation control with a solid safety record. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.